So this is where I'm a molecular guy, and I actually, without using any substance, I actually have visions on a molecular level at times. So let's talk about the molecular piece here, and I'll share a little animation with you as well that I think is kind of fun. So fatigue, right? So that's really what we're talking about. And what do we point at to understand where the fatigue comes from? That's really what this is about in so many ways. So one of the most obvious lesions is that of mitochondrial. But we also have neurological potential. We also have immunomodulation potential or immunologic potential, and even some of the cardiovascular evidence, although it's not particularly strong, and I'll argue both ways with this as we get further into this, is also of interest. Because clearly there's an autonomic dysfunction in chronic fatigue syndrome. You could put that on neurological. You could also say there may be a cardiovascular origin. There probably are cases where there is a cardiovascular origin. But when we get down to the mitochondria, we need to look at two basic things. And we saw an excellent lecture by Dr. Kaiser this morning, and he was talking about carnitine, right? So transport is actually a really big deal in terms of mitochondrial dynamics, mitochondrial biodynamics. And so transport, we can improve that. We know we can improve that. There's studies to show that we can improve that. But it is an issue that we need to keep in mind, because what are people eating? Really, it all comes back, your naturopath, right? It all comes back to your attitude, are you moving, and what are you eating, right? So if you're getting really poor quality nutrients as well as poor quality fats, your membranes are potentially acting very differently than if you were getting good quality fats. So transport's a big piece here, and the electron transport chain itself is a huge piece here as well. And of course, oxidative stress can be a problem and an issue here, but we need to keep these things in mind. If we look at neurologic membranes, again, we come back to what are you eating? Right? What's the fluidity of your membranes? And I could go on and on about fluidity in membranes, but fluidity of the membrane, what fats and how much cholesterol you have in the membrane will strongly impact signal transduction. So don't think that eating right is just some old wives' tale. Also, neurologically, we have autonomic dysfunction. Of course, the hypothalamus kind of rules the autonomic nervous system, and we may have hypothalamic issues. So this can also be paramount. Now, we can also look at glial activity, and I'm going to show you a very exciting paper that just came out in Nature. Technically, it was last year, but in my brain, I'm still in 2016. So, but there's probably some pretty significant glial activity here that we need to think about neurologically. And then we get to immunologic, and cytokines are, again, very, very key and can make a really lovely situation or can make a very detrimental situation, depending on which cytokines we're talking about. And then delayed type hypersensitivity also, and I heard Dr. Rose talking a bit about this earlier, delayed DTH can also be a huge issue. When we get to the cardiovascular side, so there's a lot of research, and I'll show you some of it, that suggests that on a tilt table there's parasympathetic deficiencies and attenuations and sympathetic dominance, and we'll talk more about that in a second here too, but orthostatic tachycardia is not uncommon. It's not every CFS patient, but it's definitely not uncommon. We also have heart rate variability that can be an issue here, and we also have hypertension, which can be an issue here. By the way, I had some time at National Institute on Aging, and one of the correlations that they found with Alzheimer's disease that was fascinating to me was orthostatic hypotension. That was one of the biggest predictors they had found thus far in all the data that they've combed through on the occurrence of Alzheimer's disease. So higher risk if you have regular orthostatic hypotension. So what does this end up with? Well, if we look at mitochondria, energy loss is a clearly obvious outcome, right? muscle weakness, post-exertional malaise, increased recovery times, all these things that we know so well in chronic fatigue syndrome are potentially an issue. If we go to the neurological side, central nervous system inflammation, that may be responsible for some of the depression and the malaise that you see. That may be responsible for the sleep issues. That may be responsible for the brain fog. It also could be responsible for the hypertension as well as headaches. If we go to the immunological side, again, we get inflammation. And I just want to say something about sickness behavior here, because I think this is something we miss sometimes. And I think the naturopathic community is, for the most part, is on it. At least it looks like it to me. And by the way, you're my favorite physicians to lecture to. I can take you into the molecular and I can take you into the energetics, and that's pretty unusual for a physician. So that's pretty cool. But sickness behavior is basically a response to an overload of inflammatory cytokines. And of course, you see in sepsis, you see a similar but very acute situation with cytokines, right? That's what kills you. So I want to say more about that a little bit later. Also, clearly, defense compromise. These people get sick constantly. Anything that they can catch, they very likely will. Pain, muscle and joint pain specifically, but also tender lymph nodes and sore throat are very common outcomes, immunological outcomes. And then I would just go back and say this is a circular issue here in terms of orthostatic hypertension and orthostatic tachycardia and heart rate variability. So, by the way, a lot of these papers that I'm going to flash are of interest, I think, for you to read. And so I'm not going to comment on all of them, or I'll briefly comment on them. But there's some really great papers out there that are worth looking into. And you should have all of these in your notes. These notes are slightly different because I can never decide exactly what I'm going to say until 5 minutes before the lecture. So, but if you want these, if you put your name on a piece of paper and your email, I'm happy to send them to you. So this paper actually was really good because phytochemistry and mitochondrial function, right? In other words, it comes back to, are you eating well? Except it does it rather technically and molecularly. And one of the things I point out is that mitochondrial functions are really tied into physiology in a really profound way. So things like iron and copper handling are profoundly affected by mitochondrial health. Obviously, reactive oxygen species. Calcium homeostasis due to sarcoendoplasmic reticulum activity is also really tied into mitochondrial health, which a lot of us may not understand. ATP supply is an obvious one. Permeability and transition. Permeability transition is a big piece. Necrosis and apoptosis are tied in. And then mitophagy or mitophagy, my preferred pronunciation, but I had somebody used to make me say mitophagy, so you may hear both from me. But mitophagy, I think, is a key place, and I think it's a key therapeutic target as well. And we'll touch on that. Coming back to calcium handling, again, mitochondrial calcium handling can really get into a lot of different areas of health. And so mitochondria obviously are involved in fatigue, but I don't think it's the only issue, but I do think it is an underlying potentially molecular issue in many cases. And then, of course, AMPK can also be a huge issue, and there are a number, not just resveratrol, but there are a number of plant compounds that can affect AMPK, and this is not unusual. And what I promise you is that in the next 10 years, the list is going to grow even longer in terms of botanicals, in terms of phytochemicals that influence AMPK. So we're going to see more and more of this. And in turn, what we're going to see is potentially effects on mTOR. So mTOR inhibition, and you're going to get mitophagy, right? mTOR stimulation, you're going to get growth. And there's always this balance, right? And I think a real clear understanding of that balance between growth and renewal is looking at our athletes. If you look at our athletes in the 70s, if you look at any photos of whether they're football players or baseball players or basketball players, you see thin but fit guys. If you look now, what do you see? Growth, right? You see these guys that are just, probably most of them are using steroids. So we've pushed the growth side, but we forgot about the renewal side. And I think that's fairly typical of an attitude that we've got in the United States, and I'm not going to get too political here, but I think economics, we have to think about that as well. So mitophagy is a pretty cool dynamic in the cell. And so essentially with mitophagy, what you're doing is stimulating a response by mTOR inhibition to renew old degenerating mitochondria. And how is that done? What's the signal to renew old mitochondria? It's the membrane, believe it or not. It's leakage. So the older that membrane gets, the sloppier it gets. It's like us. When our skin gets old, it shows. If I take off my glasses, you can see the huge bags under my eyes, right? When we get old, it shows. And our mitochondria are the same. When our mitochondria get old, their outer membrane, their skin, gets leaky. And the more leaky we get, the more ROS we produce, reactive oxygen species we produce, the more the signaling goes towards let's inhibit mTOR and not grow. And so if you look at this, I think I'm going to have to start this by hand. Let's see. Okay, so if you look at this process, and I'll give you some keys here in terms of what's happening, but new membranes, and as you see this membrane start to age, what you're going to start to see is more and more reactive oxygen species, these red molecules will come out and actually hit proteins and damage proteins and potentially damage membranes as well, right? So not only the mitochondria, but also damaging our extracellular membranes. And of course, that wreaks havoc. Now, mTOR can take signals from other proteins or from other phytochemicals, from other molecules, and let's say these green guys are mTOR inhibitors. Well, what they'll do is they'll start a process that gets proteins to bind on the wall of the mitochondria, and by doing that, it stimulates lysosomal coverage or engulfment. And what we do is we're efficient. We recycle. So we break down all those proteins and all those components of the mitochondria, and we recycle them so that we get new mitochondria. And so this is really common. And vegetarians have, and I would guess, I've never seen this data, but I would guess from just looking at the number of phytochemicals that do this, the vegetarians have a much higher rate of mitophagy than meat eaters do. Now, that's not to say that meat eaters eat a lot of vegetables wouldn't have a good rate, but that is to say that if we're eating fast food, that we're not getting a lot of this. And so what we're getting is more and more old mitochondria that aren't being replaced, leaky with ROS, and so we end up with a potential bad situation. So if we look at some of this research here, so mitochondria and muscle pain, we've heard both speakers talk about this. So this is very evident. We see this in chronic fatigue. This is no surprise. One of the things you'll see is slowed acid clearance. And then this gets transported actually to the deep cervical lymph nodes. So we end up with immunological challenge from this muscle pain, this myalgia. And then we saw Dr. Rose gave us some information on SNPs. And I would say SNPs are incredibly exciting. It's getting a lot of attention, and it's getting a lot of funding in terms of research. But I would like to suggest to you that epigenetics is probably more important than SNPs. It's not to take away the fact that SNPs can be important and affect the way we respond to our environment. But epigenetics is really what's turning genes on and turning genes off, even if they're SNPs. So keep in mind that this is really the up-and-coming science. We're going to see more and more here. And again, we're going to see more and more in terms of phytochemical influence of epigenetics. It's going to be very, very exciting for us. But what do these guys find? They found mitochondrial proteins, aconitase to hydratase and ATP synthase subunit beta are upregulated in chronic fatigue syndrome. So we definitely see changes that are very significant. And then we get to the autonomic nervous system in terms of thinking about the neurological effects. And you see, on a tilt board, and you probably are all very familiar with this, and probably many of you have learned to do this. On a tilt board, you'll definitely see changes in CFS patients that you don't necessarily see in a lot of other patients. However, some of the research is suggesting that fatigue in general, whether it be chronic fatigue or just fatigue, it's not unusual to have autonomic dysfunction. And this is very interesting. Onset of autonomic symptoms occurred within 4 weeks of a viral infection with 46% of patients.